My name is Prof.Dr. V Thiruvalluvan, Vice Chancellor of Tamil University, Thanjavur. Neurolinguistics is currently a new science developed in all over the globe. That is, the neurological and parameters of neurological and parameters of linguistic features are combined together. The interdisciplinary research maybe begins in the 19th century. From that, there are number of studies by the linguist as well as neurologist. That is, the new trend of neurolinguistics is developed all over the globe. That is, their lesions in the brain is responsible for the speech and language production and operation. That is, especially left hemisphere is the responsible for speech and language production and operation. The one area is called Broca's area, that is responsible for expression. Another area is called Wernicke's area, is responsible for comprehension. Both the areas are very important for speech language production and comprehension. If any lesions in the part of the brain, the speech and language may be affected. That is called speech disorder, especially the major term is called aphasia. The aphasia means speech disorder, whether it's a expressive disorder or comprehensive disorder. If the lesions in the Broca's area, the speech production is maybe disturbed by the patients. The causes of these lesions may be cerebrovascular accident or stroke. It's defined by the neurologist. So that the linguist role is very important for this research. Especially the role of the linguist is major part of this research, because the linguist identify the patient and make a separate test battery, that is questionnaire, for collecting the data from the aphasic patients. But the lesions referred by the neurologist, it may be correlated by the description of the linguist gathered by the data and analyzed by him. The data analyzed by the linguist grammatically analyzed and described by the linguist by the way of phonological, morphological, syntactical and semantical and paragrammatical ways, so that the linguist give a clear-cut idea about the speech description output of the aphasic patient. Then only we can classify the errors or mistakes made by the aphasic patient. Then we classify that errors grammatically. Then we are giving a clear-cut solution for a speech therapy for the speech therapist. So that the role of speech therapist is very easy to give a therapy to the patients and giving a quick recovery for the aphasic patient. This is the role of linguistics. We are giving a descriptive identification output of a aphasic patient. Accordingly, the speech therapist will give the therapy. That is very easy one and speedy recovery for the aphasic patients. That is the main role of the linguist. There are three parties involved. One is neurological part, that is done by neurologist, and another part is linguistical part, it is done by linguist, and another part is speech pathologist. These three area is very important for identifying the patients and identifying the errors and accordingly giving the therapy to the patients. That is the whole view of the neurolinguistics. So that if the neurolinguistics field is developed in all the languages, the language disorders may be identified and rectified accordingly. Now, the current trend of the neurolinguistics is very advanced, because nowadays there are lot of technical developments for identifying lesions by the neurologists. It's easy also. Previously, they are using CT scan for identification of the brain damages, and then MRI, magnetic resonance images, now fMRI, and so on. So many advanced technical available for identifying the lesion in the human brain immediately, so that medication is started immediately for the stroke patients. Simultaneously, before therapy, linguists give a clear description by the way of conducting data collection by using the test battery in various manner for Tamil situation, based on the Tamil culture and other things, because the patient is belonging to Tamil language, so that description of that particular aphasic patients may be given by linguist very easily. The process is very advanced for these technical developments. So that the speech therapist also now comes under the research of neurolinguistics under the linguistics people. Normally, the speech disorders are so many types we can describe. Linguistical classification as well as neurological classification. Neurological classification is mainly based on their neurological disorder and their utterances. That is neurological classification. That a medical term they refer that aphasia, apemia. The aphasia means speech disorder. He is not able to speak. He is not able to understand. That global aphasia. That is called global aphasia, and that anomia. Anomia is naming difficulties. The patient is not able to name the objects properly. Then apemia and then agraphia. Agraphia means the person is not able to write legibly. That is agraphia. Then another term is called agrammatism. Agrammatism is otherwise called as a telegraphic speech. The patient is not giving utterances in a normal way. A bit of a telegraphic style of speech may be uttered. That is called telegrammatism. And paraphasia is also the phonemic utterances are not able to follow by the patient comes under the paraphasia. That is Wernicke's aphasia is that is a deficiency for understanding the speech output. That is that Wernicke's aphasia, transcortical Wernicke's aphasia, transcortical Broca's aphasia, and comes under the another area is called dyslexia, another field. The dyslexia is a learning disability. It's mainly occurred in the school children or college children. Almost Thomas Alva Edison also dyslexic. So that this dyslexia may be identified by the linguist as well as speech therapist for applying various parameters. Then only we are giving a therapy for that. The person is not able to speak, but he is writing is very well. The grammatical errors are also found in the dyslexic output, and also one typical error by the dyslexic patient is mirror image errors, especially for mathematics. And another area is called autism. Autism is a very crucial disorder, especially for the early childhood children. We have to identify it after 3 years or 4 years. Then only we have to give some slow therapy, because there is no proper medicine for the autism disorder. So we are also preparing for autistic children's research in our area. Comes under the neurolinguistics and clinical linguistics area. So that another disorders like schizophrenia and other Alzheimer's disease also, there are remedies in linguistical remedies for that. These two diseases are maybe appeared in the old age persons, elderly persons. So that we are also giving some kind of therapy for the Alzheimer's and schizophrenic patients.